a gap year, either whether they're doing PhD medicine or whatever, and if that benefited them or if it hurt them in any way. I also wanted to learn if it was like a very difficult decision for these students to pursue their desired profession, and then how they overcame, like the fact that they were going to have to sacrifice a lot of time and energy. And then a practice or activity I would like to continue is just sleeping and simply doing nothing, because like Wendy, I've been super busy this summer, so I've learned to appreciate just like sleeping and chilling. So hopefully I have time to do that in the future.
My question would be, because I know LinkedIn's a big thing, I think in the bios, everyone said LinkedIn. How important has that been to you, or how has that affected you? Because I just opened mine like last year, and it seems like it's more like we talked about, it's like more like a social media, kind of see like, oh, hey, what did this person do, and maybe I should follow this and that. But other than that, I don't maybe see the benefits. Maybe, change my mind. And then what activity or practice would I want to continue? Watching like trashy shows. The villain.
I'd also like to learn about gap years. Like, I feel like that's a really interesting question, and we have like a bunch of people or various students from different fields. So I think it'd be interesting to learn about their experiences. And then an activity that I'd want to continue is like spending time with my family. My little sister plays volleyball, and she's been teaching me. So hopefully, in the future, I can continue playing with her and get better.
For me, I just want to learn about their experiences and the obstacles they've encountered and how they keep staying motivated in grad school and medicine and all of that. And activity, I want to spend time with family and sleep.
I think for me, I want to learn how they stay involved in their communities. I know different grad schools have different grad student associations and organizations. I think for practice, I want to be able to still make time to pursue creative projects and hobbies. I feel like I don't have enough time to do that now, so really tapping into that when I'm in grad school.
I guess for me, I'm kind of curious about the journey, like how they got there and their backgrounds, and similar to what other people mentioned, like if they taking gap years or how they got to where they are. And then for practice, spending time with family and friends, and I guess Beatrice said creative hobbies, because I feel like even now, once school starts, I can barely make time for that. So I can't imagine what it will be like later on too.
Excellent. Thank you so much, everyone, for sharing that. I'll stop sharing here. And the excellent thing is that our panelists were able to hear you all as you were sharing out those questions. Let's see if this option works for us really quick. Okay, I think this is really good.
It's so silly, I like it.
Okay, let's see if we can have another option just to see if this looks a little.
Ooh.
Oh, that feels very corporate.
Yeah.
Okay. I think we do have one more person coming in that we can move forward like this if you guys would like to. So great. So welcome everyone. Thank you all for coming today. It's definitely an honor to have each of you in the room. We know you are very busy. We have 5 so far, but 4 so far, but we have a total of 6 panelists here, and they are all current students in their graduate programs. I'm going to allow them to take turns kind of introducing themselves and giving you all a little bit of background about who they are and how they got to their respective careers and respective paths. And they've already been shared with as far as where you all are from and what paths you're taking. But I do want to encourage you, as you do hear them speaking, to take notes if you have questions, and make sure that you kind of, take notes. And then also you all have their emails, because they are available for you to reach out via LinkedIn. So make sure that you do that. So with that being said, thank you so much all again for being here. At this point, I want each of you to take a little bit of time to introduce yourselves. And at any time, if we are asking questions and you all cannot hear us, please let us know. So what we'll do is we'll go from left to right from who we see here. So if Carlos, if you would like to start by introducing yourself, letting us know a little bit about your background, where you are now, and anything else you would like us to know.
Hi, everybody. So I'm from Fontana, California. That's like out a little bit out east in San Bernardino County. I got my undergrad at UCLA, studied biochemistry, graduated in December 2020, and we can talk about that a little bit more when we talk about the gap year. Currently also working there as an intern, and now I'm going to UCI School of Pharmacy.
Excellent, thank you. Maxim?
Yeah. Hi, everyone. My name is Max. I am from Chicago, and I went to Northwestern for my undergrad, where I studied psychology and neuroscience. And then I stayed there for about 2 years. It's kind of like a postdoc position to get some more research experience before I started here at UCI in the clinical psychology PhD program. So I'm a second year now here, and I study risk for psychotic disorders in sexual and gender minority populations.
Thank you so much for being here. And Teray?
Hello, everyone. I am also from Fontana, California, funny enough. I did my undergraduate at UCI. So I got a biological sciences degree. Now, I also took a gap year, so we can talk about that as well. But I currently go to UCLA, and I'm getting my master's in nursing.
Excellent, thank you. And Abraham?
Perfect. So, my name is Abraham. I'm currently now second year student, a medical student at the College of Osteopathic Medicine at Western University, which is in Pomona. I'm originally from San Fernando Valley, and I went to UCLA, graduated with a psychobiology degree in 2020, the COVID fun year, and then took 2 gap years before I started medical school. So we can talk about that and open book. So any questions y'all have about the MCAT, gap years, how to prepare for graduate applications, I'm all ears and I'm glad to be here.
Excellent, excellent. Okay, so to get us started, can each of you, or if you want to take turns asking, can each of you tell us a little bit about if the path that you chose was your original path and what confirmed your particular health profession that you chose to pursue?
Yeah, so I can go ahead and get started with this. I actually didn't know that I was gonna apply to pharmacy school until my my second to last quarter of undergrad. I went to the doctors and I got long story short, I got my ear blown out. So I'm like, oh, I want to join the medical field now. I just thought that with all the stuff about like receptors and molecules that I learned, I thought that pharmacy was the best fit for that. I kind of I was really naive about it. I thought it was just retail like CVS or Walmart. So I kind of went in blind, and I got really lucky that I actually really like what I do. So
Excellent, thank you. And then as we're going through, if you guys have any follow-up questions, feel free to just raise your hand if you do have follow-up questions for any of the panelists. Oh, yes, we do have a question.
So what do you do in pharm school?
we basically have to learn everything about a drug inside out. The dose that it comes in, who are the patients you can give it to, who you can't give it to, how it interacts with food, or other medicine. You name it. We're supposed to basically be the experts on drugs.
And I do have a follow-up question for you. So now that you're in your pharmacy program, where do you see yourself in the future? What type of industry within pharmacy do you see yourself going into?
Yeah, so there's a lot of types of pharmacy. Like I said before, I thought that there was only retail, but there's actually pharmacists that are hidden away in the hospital that you don't really see. It's a really growing field nowadays. What I want to do particular is something called industrial pharmacy. So I want to work for the industry. So there's two main paths that you can go down with that. You can go the business aspect of it and basically explain to government why or whoever why medication should be covered or not. And then you can go to the more science aspect of it and dive into the like clinical studies or drug design.
Excellent. Perfect. Thank you so much for that. Is there anybody else who wants to go next to discuss their route and if that was your original goal?
I can go next.
Thank you.
Yeah, so I actually started as pre-med at Northwestern. So I majored in chemistry and did like molecular biology research for like my first 2.5 years there. And then I took, this is very cliche, but I took an intro to psych course and just like fully kind of flipped what I realized I wanted to do. Because I realized that the studying psychopathology really interested me, but I think that the people aspect was really what did it for me. And also just being able to do like community oriented research more. So like kind of even more getting into like public health and looking more at that kind of level of things. So yeah, I switched later in the game and then kind of started doing more neuroscience and psych research. And then, yeah, I got into psychosis, which I kind of just fell into. So I didn't really know. For me, I just knew that I wanted to study risk for psychopathology because that's something that really interested in me. Because I was really interested in looking at like risk for psychopathology and mental disorders in marginalized communities. And so I didn't really know what beyond that, but I knew I wanted to study risk. Just kind of fell into it, really enjoyed it. And then I did like a post-bac position at Northwestern for 2 years, which is very common for clinical PhDs to get like extra research experience in whatever you're doing. And then, yeah, I ended up here studying, psychosis risk at UCI when I was like a chemistry major at Northwestern. So it took a lot of kind of twists and turns, but ended up there.
Before we move on, I do want to see if any students have any follow-up questions for Maxim. Okay, excellent. Thank you so much. And then I kind of switch you guys around. So let's see who's next. We did have Malika and how do you pronounce your name? Negrin? I want to make sure I'm saying that correctly.
Nagin.
Nagin, okay, thank you. Welcome to both of you. So we're just doing brief interjections at this point, just kind of saying what health profession you are in, how did you get there, where are you from? So if either one of you want to go ahead and join in.
I can go first. So my name's Malika. I'm from Sacramento. I went to UCI for undergrad. I graduated 2 years ago now in 2021. I wanted to be an optometrist my entire life. So being at UCI was perfect because there's a lot of optometry schools close by. And so I just got access to the different optometry schools through being at UCI. And I took one gap year and now I'm in my second year of optometry school at Western.
Awesome, thank you.
I can go next. My name is Nagin Silani. I grew up in Iran and I moved to San Diego when I was about 16. And then I went to community college first, and then I transferred to UCSD for undergrad. And I also did a master's at Barry University in Miami. And I'm currently in second year of dental school at Western.
Thank you so much. Okay, do we have any other follow-up questions before we move to our list of questions we have?
Yeah.
Yes.
I forgot who it was, but he was talking about public health and community. But my question would be, how much of that time, or what would you recommend towards like volunteering hours or like community-based to get involved with you?
And was that our speaker, Maxim, who was in the clinical psych program? The clinical psych?
Yes, yeah.
Okay. Sorry.
So UCI is a bit different. The psychology program is actually in the School of Social Ecology here. So it's like, it's not in the social sciences, which is typical. So this school also has like urban planning and public policy and criminology. And so everyone here's research interests kind of relate to psychopathology and mental disorders, mental health in the context of communities and like contextual factors. So one part is just kind of looking at programs that really kind of foster that and support that. But before I got into the program, sorry, I'm like losing my voice. This is my fourth Zoom today. But I volunteered at like a youth center run by social workers. So it was for like youth in the community who just wanted like a place to be, but also maybe, you know, didn't want to do therapy for whatever reason, right? It's very stigmatized, finances, but they wanted some kind of support. So I volunteered there, and also was in like organizations related to just like mental health advocacy, those kinds of things. And then once you get into grad school, there are also a lot of ways like at UCI to get involved with like community like DEI organizations in the department level. But also before grad school, I also joined like some like DEI oriented initiatives like and like conferences that we attended and things like that. So you know, not everyone does that, right? It's like kind of depends on what your interests are and what you want to do. But I think volunteering and in community organizations that also overlap with your interests is a great way, right? Like I volunteer at like social worker run community center, but also just in general professional organizations that you know, do kind of service work and things like that.
Excellent, thank you. Do we have any? Yes,
I also have a question for Max. I was just wondering, like, how does the school support or support your research in terms of sexual and gender minority research is like really understudied and still, you know, becoming a big field. So how do you feel like the school supports your research in that way?
Yeah, that's a great question. It's a very big question. And so I think that for me, that was something I always wanted to do. And a lot of people I think that come into, I mean, lots of fields, but especially clinical psychology, I feel like in UCI are interested in specific communities that they often belong to or have interest in, right? And so my mentor is really supportive of it, right? That's how clinical psychology actually works, is like you apply to a mentor and then the school is a secondary. So like you don't really apply to like UCI, you know, clinical psych, and then you pick someone. It's like it's the opposite way. So like you identify people that have similar interests to you and you think would be supportive, and then you know you kind of meet with them and see if you might be a good fit. So the support kind of starts at like the advisor level there, and then you know that's like where funding also happens, like grants and TAing and things that actually fund your research. But yeah, to be honest, like I'm the only one in my lab that like does this kind of research, right? I'm the only one in like the clinical program that does it. And so it, you know, that can be like alienating is an intense word, not alienating, but that can be like, you know, tough sometimes, right? Where no one else is really sharing that interest or doing that, but also gives you a lot of opportunities, I think, because you can there's a lot to be done and a lot to you know, to do in terms of research. I feel like, unfortunately, which, you know, I'm sure a lot of people can relate to for different reasons, like you kind of have to make a space for yourself and like advocate for it a bit, because that doesn't often exist already, like a structure or those interests. And I think people are getting better at like seeking out students that have those interests, but yeah, it's like partially advisor that supports you, and then you kind of do have to do some extra work on your own, unfortunately, but it's kind of like the nature of academia and that kind of stuff.
Any other follow-up questions to that? My question would be for those of you who are first generation, or even if you're not first generation, can you share with us maybe a experience, a resource, a person who really helped you find your particular path? As a first generation students, a lot of times there are kind of additional obstacles that we must overcome. So for you, those of you who are first gen, can you share if there were particular obstacles for you? And then if there were, what were the resources that helped you overcome them for you to be successful in getting into your program?
So I'm a first generation student. In high school, I didn't even know what financial aid was. So I was definitely one of those high school students that was like, college is like a movie scene, right? Like it's one of those things you kind of like dream about watching movies, but not everybody really goes through. So it was one of my teachers that actually like told me about financial aid and helped put me on the path to actually like understanding that I could apply to college. Once I got into UCI and I actually dormed the first year because I couldn't commute type of thing, I didn't have a car. The financial aid office was like my best friend. So I was in that office. They knew me first and last name. They helped me get involved on campus. I was a campus representative for 4 years. I was a resident advisor. So, um, really just trying to plug myself into the school and getting to know all of the different resources, such as the financial aid office, the undergraduate resource center. There are people there that like are specifically hired and tailor made to look out for first generation students and kind of answer our questions, help us communicate some of the nuances of higher education with our family members, helping us navigate what does it look like when you graduate. The Alumni Center is great for that. So those are the resources that I really tapped into and helped me kind of model my 4 year experience.
Thank you so much. Anyone else?
Yeah, I can go too. So, when I moved here, I was 16 and I started with community college, which was better because it was a smaller setting and I really utilized the same resources that you mentioned, like financial aid office, counseling office, to like kind of plan out. Like I kind of knew I always wanted to do dental, but like for me, I never knew like, oh, I need to take a DAT exam because I didn't go through SAT or any, I didn't know the system. So for me, it was just like taking classes. I didn't even know the grading system, like getting C's is bad. I was like, oh, okay, I'll just pass them. So it's just like for me, talking, like not being shy, like asking a lot of questions and getting yourself involved. Like, yeah, you might be tired and going home, like just talking as many like people comes along your way, like and asking questions, and like you can kind of figure out your path, I would say. And through those, like when I got involved, like I found like mentors and I was able to like transfer, and in UCSD I was able to continue.
Thank you so much. Anyone else want to speak to their experience?
I just like wanted to add that I found like adults and counselors and staff like very helpful, but I think the best resource for me was older students that had been through the exact same thing. Because it's one thing to like hear it from a piece of paper and like someone whose job it is to tell you what to do, but it's a different thing for like someone's personal experience and like obstacles that you might not have realized. Another thing that really helped me was like immersing myself in the environment I wanted to be in. So for example, at UCI, there's a UCI's pre-optometry club. So I was like really heavily involved in that club, and there's a big little system within that club. And so it was really helpful just to like talk to my big, and like they're applying optometry school and to help me get in. And it's really cool because I'm a second year now. So there's like first year students that were my littles in UCI's pre-optometry club. So it's just cool how it's like a full circle moment. And I just think really relying on upperclassmen that have been through the same thing is like the best way to go.
Excellent. Excellent. Thank you so much for that. And I think just that plug for UCI pre-optometry club will be great because I think we do have a couple of pre-optometry students in our scholar group. So thank you for that. Excellent. Anything else anyone wants to add? And then any questions from students? Okay, as we go forward with these, I did want to mention, do we mention the anonymous questions there on Women's Health?
Yeah, if you all have any questions that you may feel uncomfortable asking in the public setting, we did set up a Mentimeter for you all to submit your questions. So you can go ahead and just head over to menti.com and enter the code on the board, and I'll be able to see the questions and raise them for you.
And that way you guys can raise anonymous questions so we can just ask. Okay, perfect. Let's see. So let's move on to your life in your program now. So can you guys describe a little bit about what graduate school is like for you, because each of you guys are in very different programs. So can you guys give us a little bit of overview of what it's like and maybe the biggest difference from undergrad and now going into your graduate program?
I think I'll go with this one. So, as I said, before I go to osteopathic, the Western use osteopathic schools. So essentially, medical school plus a little bit of the osteopathic medicine aspect of the program. And so, what that means is we do everything that medical school does and MD program does, but we also learn the osteopathic principles and there's certain body manipulation techniques similar to like some chiropractic, some massage, and some other techniques being integrated with more diagnosis. So that one thing that we kind of say is we're MDs plus we'll have 200 hours of additional treatment thinking and to create that more holistic medicine aspect that osteopaths really strive for. And so when the question immediately asked was like, how is your grad school life? The first thing that popped into my head was a lot. It's a very much a big jump going from undergrad where there is like you may not feel you have like a lot of free time on your hands, but trust me, going from undergrad to graduate school, they like to throw a bunch of things at you to memorize and learn in a much more condensed amount of time, especially correct me if I'm wrong, UC has also a quarter system school, which UCLA was. So there's a lot, even though that was accelerated too, they still try to pile on as much as you can, as much as somehow we can physically, humanly can in the span of a couple weeks for each system or each topic that we're learning. So like I learned most of, like in the last 3 weeks, I learned most of all cardiac pathology, physiology in 3 weeks. So it very much comes into a point where you just have to learn a lot more time management skills. You have to figure out a balance of your schedule. I think right now is the time where in undergrad is to figure out what your passions are and what you want to do so that when it comes time for graduate school and you have less time, you can be more efficient and do a lot of things. So on my free time, which the few that I get, I'm still a musician. So back at UCLA, I was trying to work on my craft a little bit more to a point where now I can go into a studio and just like if I book like 3 hours, but for me to just write some things, I can do it very fast now. Or like if I want to spend time with family, which I know when to give myself that time. So a lot of undergrad, and what I tell people, especially because I do a lot of mentoring with students at UCLA, is you essentially should build the foundation of who you are as a person. Because as much as you want to grow as like you are doing a lot of growth professionally in graduate school, there isn't that much time to really be like, I want to personally grow in this aspect. You are growing through all the rigor of graduate school, but figure out what your passions are outside of career. Like career is important, sure, but that's one part of your life. That work-life balance very much comes down to how you manage your time. Because yeah, when you get to graduate school, it's gonna be tough. When we start to become, say, I heard everyone was like, there's a pharmacist, being a future pharmacist, and a future optometrist, a future nurse, future psychiatrist, and essentially just comes down, and a future nurse essentially just comes down to you're gonna have such a huge busy schedule. You're gonna still have to prioritize who you are as a person because that's what's gonna make you a better person in your career. So just to answer that, that's my day-to-day is mostly studying, but I'm still trying to figure out those paths to be like, I want to do research. I'm really interested in research and how important it is that the way we think about medicine has to do with how we creatively think about the advancements in it. So whether it is working with different pharmacy clinical trials, whether it is trying to figure out optimization of medical workflows in the on a floor or in a clinic, it very much comes down to your critical but also creative thinking. So that's where I prioritize being a musician, is because it accesses that other side of my brain that will help me become a better physician. So that's a little bit of a long way to answer it, but yeah, open to any follow-up.
Excellent, thank you. And that's so great to hear that you are continuing to kind of have that other aspect of your life as far as your musical interests to incorporate that even in the midst of medical school, because you don't hear that very much as far as your time and being able to do that. So it sounds like you kind of nailed down that time management and how to, prioritize yourself and your work that you're doing. So thank you so much for sharing that. Does anybody else want to share about the kind of the difference from moving from undergrad to grad school, and maybe also how you are managing your time?
Yeah, so I think he did an excellent job of really highlighting the fact that um, essentially pressure makes diamonds, and any graduate program you go into wants you to shine. So they're going to apply that pressure. And the less time they have with you, the more pressure they're going to have to apply in very specific areas to really get you to shine the way you need to before you leave. So I think undergrad does an excellent job as a young adult helping you kind of move into this professional sphere of when you graduate, you're going to get a job and really work out into the world and dealing with real lives. Graduate school is refining you to be a master at whatever it is you so choose. So there's a very stark difference in effort. There's a stark difference in time commitment, the expectations. One of my quarters, I had 6 classes and clinicals on top of that. So 6 classes, and these are not like, oh, intro to this, intro to that. No, this is advanced pathophysiology. Every class has like advanced in front of it just to get the point home. The syllabuses are out like 2 weeks before the class starts, and they're like 30 pages long. So, and then you're in the hospital for 12 hours, right? And so you're dealing with patients, you're passing medications, you're shadowing, charting, etc. And the expectation is that you do all of that and then still maintain excellence. You do all of that and you're not just present, but you are making a difference. You're bringing your own personal flair to whatever it is that you're doing. I can't emphasize enough how important it is to develop yourself as an individual before you get into whatever program you're looking to. I took a gap here and I took a lot of time to do that personally. All of my mentees and the students that, I had the honor of mentoring from UCI, I've always told them that you're a person first and a student second. So regardless of what educational pathway you want to choose, you can't forget who you are and what makes you happy. Because there will be times where you're stressed, and it's important to know, how do you cope with stress? How do you relax at the end of the day? How do you go about filling your cup when you feel like you've poured yourself into so many different involvements and things that, mean a lot to you, but at the end of the day, they're still draining from your cup? How do you pour back into yourself? So really knowing how to stay in tune with yourself while going through these programs, I think, is the highlight in terms of skill on a personal level that I think each person should have before choosing to go into a graduate program.
Thank you so much. Thank you for driving that home, that you are a person first and then a student second. I think that's really important for all of us to remember. Excellent. Anyone who would like to go next on that topic of from undergrad to graduate?
I can go. So I don't know if anyone is interested in dentistry. So one main thing is that like I was taking a lot of bio classes, biomedical classes, which you're still learning all those. But on top of that, like when you come home, like it's not just like studying, like we have hand skills to work on. So a lot of times like after 5, like we're staying in school and like practicing on those as well. And then by the time you come home, like you have to study on top of it the morning classes. So what they emphasize on like knowing your time management skills, like it's very important. And it's just like whatever path you're taking, like just make sure you like it, because whatever you do, like it's going to be hard. As long as you love it and you're passionate, you can go through hardships. So I would say like really make sure like before undergrad, like to shadow and like really know if you like it or not. Because we had some classmates that like they didn't like it and they had to like drop out or something. So I would say like if you have the time, like try to explore. And as far as like time balancing, I would say like you're spending a lot more time with your classmates in grad school, and like you may have like less time to like spend time with family, but make sure like you put those time, because like they will ground you, and like that's a good way to like remember and like thank them, like they helped you to get where you are. So I would just say like family time is important too. And what Abram said, like I do music too, so if I get the time, yeah, like I'll try to do a little bit of music as well.
Any other contributions to the undergrad and to grad advice or information? Yes, thank you so much for those that shared about that. Something that both of you did mention was the gap year. So of those of you that took a gap year, can you talk a little bit about why you chose to take a gap year and the benefit that you found from it? Or maybe if there wasn't a benefit, tell us about your gap year experience, if you did take one. First of all, how many did take a gap year, just to get a quick? Okay, everybody took a gap. Great. Okay, so can you all talk a little bit about the gap year and just kind of what you did, what you got out of it, how a gap year is viewed from your industry perspective, from your career perspective?
I don't know if I shared this, but I was originally B-Med. So I did like 3 years of colon cancer research. I was published. I had taken the MCAT. I was good to go. I was ready to apply after graduation. I actually got into something that UCI's medical school offers called the Prime Academy, which is an opportunity. It's a 1 week summer opportunity for pre-med students who are interested in serving minority communities to learn more about what that looks like. Um, and so UCI puts that on, and that was a great experience for me. But after going to that academy, it actually showed me that I need to do a little bit more shadowing to really solidify what I wanted to do. And that's when I ended up changing my mind to nursing. Um, so that gap year gave me time to reflect and really like see what my priorities are and what it is I wanted, not just out of my career, but also for my life. Um, it also helped me develop as a professional. So I went and worked for a company called Edwards Life Sciences, who is based in Irvine. They come to UCI all the time and do job fairs or what have you. So I suggest all of you go talk to them. They are very receptive to UCI students. They hire engineering students, biochemistry, etc. Um, and it was nice because they really cultivated that professionalism in me and showed me a different aspect of the business world. But that gap year, I really took time to work on myself, build up finances. So I was working and saving up money for my program, as well as just really becoming concrete in my newfound decision and the new path that I had taken. So my career looks at a gap year as a good thing, especially as a nurse being the front line in terms of you, when a patient gets checked in, you're the first person that sees said patient, charts on said, like you have to know kind of the basis of what the patient is going through so you can assist your med team with, hey, this is the baseline, these are kind of what, this is the vitals, what we're looking at. These are the things that I'm seeing just from the quick little interview I did. They want you to be a little bit more seasoned, a little bit more experienced because you are dealing with the general public, and that can not always be the most fun time. So knowing how to be the bigger person and be mature in immature situations, and also knowing how to connect with people, and may take a little bit more seasoning. You may need to live a little bit longer just to be able to engage and meet people where they're at, and it's definitely a skill. So other than just hardcore skills of knowing how to study and memorize certain pathophysiology diseases, there's soft skills such as communication and social skills is connecting with others and knowing how to understand and listen when you need to. That year can really help you develop.
Excellent, excellent. Thank you for sharing that. Does anybody else want to go next as far as that question?
Yeah, so I actually had to take a gap year because Since I didn't know I wanted to go into pharmacy until I was about to graduate, I was missing some requirements like communication and psychology, and I didn't want to pay for a post-bac program, so I just delayed one of my last classes and I enrolled into all the other prereqs that I had. So during that gap year, I just kind of took the time to continue working on campus while I could as a student and just enjoy myself until I knew that I was going to go into grad school. Um, I would recommend taking a gap year if you need to like strengthen your resume or save up money for grad school. But a lot of people kind of get lazy and they say next year and they keep saying next year and next year never comes. So if you're in the position to, I would recommend to not take a gap year.
And I just definitely want to add to that as far as, I think that was a good point as far as having a plan. So yes, a gap year overall can be a positive thing as long as you do have a plan. So I think that was your point, Carlos, just to kind of, if you are going to take a gap year, maybe have your support team in place as far as advisors and research or work or whatever you're going to do in that gap year so that you can have a plan and hopefully have those mentors and accountability to kind of keep you on that track if you are going to take a gap year. Would you agree with that?
Yeah, I would agree with that, but I just want to be clear that there's nothing wrong with taking multiple gap years if you need to. I'm just trying to say to not be lazy and or like forget about your dreams, you know?
Absolutely. Hey, anybody else want to speak to the gap year experience?
Yeah, I just wanted to add, from like a first generation point of view, and like I knew no one that had been on this path before me. I guess I just thought a gap year might be interpreted as a negative thing, but like experiencing my gap year, I realized a lot of things. For example, like applying to school is incredibly expensive. So like you want to apply with your best foot forward. For optometry, you have to take an OAT, which is like similar to an MCAT or DAT. It's just an admission test for optometry school. So studying for that test can take months of your life. So imagine trying to have a full-time schedule and working and studying for this test. So I just like wanted to put my best foot forward. I was also finishing some classes. And then there's also like no timeline for everyone's journey is different, which is like completely true. And I'm actually like one of the youngest people in my class, even though I did take a gap year. So if you're worried about comparing yourself to others, don't compare yourself to others. We're all on different journeys. And like he was saying, everyone just has their own timeline and stuff. So
And I would like to also add, so I graduated around 2020 and I knew I'd have to take a gap year, and it was back at a time where things were changing, in person went to virtual, yada yada yada, and we all know the story with that. But essentially what I kind of thought about was, okay, I'm going to be applying to medical school. I want to be a part of the healthcare team. And if I haven't had the experience of being a part full time of a healthcare team, how do I know that this is for me? So and then here's the thing, like, I'll be very honest. The way they view someone that is a current student versus a current graduate is very different. They take you a little bit more seriously when you become a graduate. They're like, they've gone through it. They're not just a student. This is your first priority, being here as a full-time employee, working with patients every single day from Monday through Friday, not 9 to 5, it was 8 to, and it would say 5, but I'd be there till 6 sometimes. On surgery days, I'd be there from 6 to 6. And it very much came to a point where if I couldn't see myself doing any other thing, if I could see myself doing anything other than this, then this path is for me. This path is not for me. So being in healthcare, so what happened was I graduated in June 2020, and then 2 months later, fortunately, I will say Indeed.com works. Somehow I got somebody called Corey, the office manager. He called me. He was like, "Do you want to come in for an interview?" I'm like, "Sure." And then like 2 days later, I go to the office and I get the job. And I didn't expect it. It was an ophthalmology clinic. That wasn't something where I was like, "Oh, I'm passionate about it." I was just trying to apply for a job. Finding a job is hard, by the way. Like, if some of you have found like trying to figure out their resume and they've been sending emails on emails. Yeah, to find an opportunity is hard. So when someone opens a door for you, you do not close it. You go in, you run. You run in because you want to make sure that no one opens doors for you in life. You have to either open your own doors or someone will give you the opportunity. And thankfully, I took it. Thankfully, I opened that call from a random number that I ran because I applied for that job at the middle of the night. I'm like, you know what? Let me just send this. And it became a great opportunity where I not only I was a scribe, so I was a medical scribe, but then at a private clinic. But private clinics mean that you do a lot more than your job has been asked to do. So I was working not only in a clinic, but 1 or 2 days in the week, I'd go to a surgical center, and the physician would do cataract surgeries. And so I was working with anesthesiologists, I was working with the OR nursing staff, and then at the clinic, we had an optometrist from Western. So that's also how I knew things and about Western. And so very much, and then I was also part of my task was sending medications to pharmacies. So like I was getting really integrated into it. And not only that, I was also be able to go into research. And through the job, the doctor actually sent me with him to DC for a conference, and I was able to present there. So you don't know what opportunities lie to you, but if you close a door, you know that the one thing that you know is that job's not there. So to say like I tell all my mentees, you're taking a gap year. Not only just it's for a professional and personal growth perspective, because a lot of my classmates they came in. It's by the way, becoming a doctor is not like Grey's Anatomy. As much as that show is high quality entertainment, it is not like you have to know what you're going into, because sometimes I was going in like I was talking. I'm even like a couple days ago. They're like, "Oh, when we first got in, I was so overwhelmed by taking a history and physical and like what it means to like write a note." I'm like, I did that for 2 years. Like, and then when people are students above me, they're in their surgery rotations, and they're like, "Oh man, I'm dying. I'm dying." It's like, "Oh, so you're taking like a 5 minute break for lunch? Is that it?" Like it's like been there, done that. Like, and you want to come in with that because you get ahead. Like, even though I'm like around average, below average with my um with with my age in my class, the maturity's there because you've been a part of a team. You know how to work with a doctor. You're not in you working with a healthcare team, and that's what becoming a doctor is. You have to know how to work with every single person on that team and be a good member of that team. If you can't be a good member of that team, you can't lead that team. So that's why I really, really love, like, honestly, like I will say, like my experience, it's not like it's not found everywhere because the physician I work with gave me a lot of responsibility, a little too much responsibility at times, and yeah, it came to a point where he was just chilling, and then there was a resident. He was like, "Hey, Abraham, just teach him some things." I'm like, I'm not even in medical school with Dr. Schultz. Like, I don't know. But essentially, you don't know. Like, once you get into medical school or you get into a graduate program or anything, you're stuck in a limbo of studying. So that life experience comes at you during rotations, and you're going to be put into a spot where like, do this, and you're like, what? You're going to be shocked. So get yourself prepared for what healthcare is. And yeah, because you may be like, what this doctor thing, oh shit, like it's there's a lot. It's a lot. Like I'm telling you right now, it's a lot. And so there's so many different careers in healthcare. So if you want to join, you'll start to see, oh, this OR nurse job, like it's cool. Or like, oh, PA, like PAs have like they have a much more fixed schedule. They get to dictate what they want to do. They're not strive to just one specialty. And a pharmacist, like it's like say like I was working a lot of FDA trials, and it's like, oh, there's a lot of little back end things about how to develop a drug. There's a lot of cool things in healthcare. And yes, Grey's Anatomy. I love House. My preference is House and Scrubs compared to a Grey's Anatomy for medical shows, but that's beside. But there's a hyper fictionalized, and especially in the immigrant. I'm Middle Eastern Armenian actually, so as you hear, they'll be like, you're either a doctor, engineer, or I don't know what you are. Essentially with your jobs. So long-winded way to say gap years are essential, and if you can work and save money, like I would just live in my parents' place And they were like, we'll pay for your gas. I'm like, cool. And so I have a lot of money just in my bank account. Like I don't have zero, which I have a little more than zero, which is great. So that's my answer. Please, if you can, take a gap year, learn to be a part of healthcare before thinking, like, in order to know you want to be part of healthcare, be a part of healthcare.
Excellent advice, excellent advice. And thank you so much for sharing. Every detail was very informative, especially your job in your gap year really gave you an insight, and not everyone will have that opportunity, but that is an opportunity to be able to get into a space where you are faced with things that you may be faced in your graduate program. And so to be prepared for that ahead of time is definitely priceless. So thank you for sharing that experience with us. Does anybody have any follow-up questions for that?
We do have an anonymous question.
Okay, perfect.
So we had an anonymous question come in, and that is, for those of you who are first-gen students, what are your biggest sources of support at the graduate level?
Great question.
I got you. It's my mama. 10 out of 10. It's my mama, man. Even through undergrad, like when I was an RA or when I was having a long day at work and lab, like I'll come home sometimes. I sit down and call mom and be like, "Do you know what just went down today?" And she'd be like, "What? Tell me all about it." Right? I mean, she wouldn't even. It's not the fact that she knew exactly what it was or had definition of all the big words I use sometimes. It's the idea that you have somebody that loves you, that's in your corner, that is just trying to lend an ear at the best. They just in your corner and trying to listen to you and hear you out. um I think family is really, they were unsung heroes. Some of us who, we know we can't relate with them, they know they can't relate with our journey and what we're going through, but they want to see us accomplish all the things we can. They want to see us go as far as we can. They want to be there to, be that stern hand to push you sometimes when you're moving a little bit too slow, but also, to be a soft place to land when you really do need some rest. So for me, the support really has been my family, my mom especially. Beyond that, my pillows. Man, I heard one of y'all talk about your hobby is sleep. Ditto. Me and my pillow are best friends. So I suggest, you go to Sam's Club, Costco, find you a nice little Tempur-Pedic knockoff pillow. Find you something you can really see yourself just laying down and going straight to sleep. That pillow has served me very well.
Thank you. You want to repeat the question just so we see?
Yeah, if anybody else would like to answer the question, it is, for those of you who are first-gen students, what are your biggest sources of support at the graduate level?
I would definitely have to agree that it's also my mom, but for I think another big source is friends, especially your classmates, because they're going through the exact same thing that you are. So nobody's really gonna understand you better than they would if you're complaining about like work or how an exam went. They're gonna be like, "Yeah, I hated that question too. I didn't get it." So yeah, for me, I think friends, my classmates are some of my biggest source of support.
Or anybody else want to contribute to that?
I would say so there are like clubs in grad school as well, but I know like we're all gonna be super busy. I don't know if we can utilize it as much as we did in undergrad, but they are available if you feel like you're out of place in school or it's very hard for you to connect. Like you can also, if you're super involved in undergrad and you like those things, you can also continue in grad school as well. And yeah, as they said, family is so important and we're gonna be super busy like with our classmates and stuff. It's just good to like have them, and yeah, just adding the club thing.
And I did have a quick question I want to follow up on. I think it was Teray or Abraham. Did you mention Edward Life Science, a place that you work at postgraduate?
Yeah, I did.
What, can you clarify what that is? What job that or company that was?
So Edwards Life Sciences is a medical technology business that, similar to Johnson& Johnson or Medtronic, their goals are to make devices like heart catheters, Foley catheters, et cetera. Things that help, well, Edwards specializes in all things heart, but things that help medical practitioners such as doctors and myself assist patients in ways that, medications and certain physical therapy can't. So these things such as stents, there's so many. I'm going through all of the limbs numbers in my head. I served as the laboratory coordinator while at my time at Edwards. And for those of you that asked about LinkedIn and like experiences, something my mom always told me: closed mouths don't get fed. So while I was at Edwards, I did a lot of connecting. I did a lot of conversations. I had them teach me how to build my LinkedIn. In my interview with Edwards, I told my future supervisor, I didn't know it was going to be my supervisor. I told her something that was really important to me was mentorship, and that she would set aside time for me so that we could talk about my performance and talk about moving forward. Because I never wanted to feel stagnant. I always wanted to feel like I was progressing in one way, shape, or form. They gave me a job offer as a study director of biology over there. I got an engineering job offer just from being able to visit all the different business units that they had there and kind of be a kid in the playground. And I sent emails to like the CVP of quality development, the senior vice president of business and marketing, and was like, hey, I'd love to have a sit down and just speak with you about X, Y, and Z. And the nice part when you work at business is they don't know what your job title is or like how important you are sometimes. So, you just gotta like, you dress professional, wear a little button up. I would go to Ross and Marshalls, go to the clear section, get you some nice slacks, a button up and a tie. And I'd go to work with a smile on my face and be like, all right, who are we gonna connect with today? But it was a great experience. I got a lot of connections out of it. They taught me a lot. I have a lot of mentors now that are in my corner and texting me like, hey, can't wait for you to come back, or can't wait to see what you go off and accomplish. So that was another really good highlight for my gap year, is just seeing how much support is really out there if you tap into it. I think each and every person, you're all bright, you're all intelligent, you're all capable of accomplishing a lot. So showing people around you is never a bad thing, because it gives them perspective of your journey and what you're trying to accomplish. And it may just earn you a few more allies along the road. And it takes a village sometimes to get you to where you're trying to go. So it really helps.
Thank you. Thank you.
Follow-up question on that?
Yes, we have a follow-up question.
Yeah, so Edward Life Science, they have a lot of virtual events to recruit like new incoming, did you ever go to one of those, or how would you recommend like navigating that? Just ask questions.
Like getting a job after undergrad?
No, navigating the virtual like events or the career like stuff of Edwards Life Science they host, if that makes any sense.
Yeah, so they do a lot of outreach and virtual events. I actually chaperoned a few of them. The idea for those events is not only to kind of educate y'all, but also see who's really interested. So I would say whenever you're in a room, you always like right now, right? You just asked a really great question. If you were trying to make a lasting impact on the panel, you always be like, hi, my name is so and so. Appreciate the answer so far. And then this is my question. And you would think, oh, it's not that important, but like hearing your name, and then when I'm going through job applications, I'm like, oh, this name feels familiar for some reason. It really does make a difference. So even if you don't have a question, make one up. Even if your moment is just to be like, hey, I appreciate y'all time, etc. Also, Indeed is how I ended up getting hired through Edwards. So shout out Indeed. I didn't actually know about Edwards until after I graduated. But those virtual events, and they do on campus events too during like the career fair. I forget when that is now. But they'll be boofed up, and they'll send some of us to go booth that and like answer y'all's questions. Making sure that you always, have your name, or like have your LinkedIn made and updated. If you need help, you can look at our LinkedIn's. Mine is not the best, but it's better than nothing. So, learn to mimic it, or see somebody you really like on LinkedIn and then kind of mimic theirs, And don't feel bad if yours isn't as long as theirs. I've seen like a LinkedIn that I had to keep scrolling through, and I was like, good Lord, you did everything. But just putting your best foot forward and learning how to speak highly of yourself without sounding like you're boasting. It's an art, but applications will have you do it too. So when you apply to graduate school, you got to pat yourself on the back a little bit, but not too much.
Thank you. So we do have our scholars are consisting of a pretty diverse group of health profession interests. We do have quite a few students that are interested in going into the clinical psychology. So my next question is for Maxim. Can you talk a little bit about how you decided on your particular career route? And then what options as far as in the workforce will you have or are you interested in after your degree completion?
Yeah, so this is good because I want to also clarify some gap year stuff about clinical psych. So it operates a bit differently, where gap years are the expectation for clinical psych. And it's very rare to start a clinical psych PhD right out of undergrad. And it's not really recommended either, and it's just very rare that it happens. And so typically people recommend taking at least 2 years in between undergrad and starting grad school in order to develop research experience, get publications, and just like work in kind of research settings. And it's 2 years is kind of like the recommended time, but some people take like 3 or 4 years even. That's not uncommon to see. And so it does take a bit longer sometimes to get into clinical psych. And it's very common to apply many times as well. It's very common to apply like up to 3 or 4 times to get in, so different cycles. I got in like first time I applied, but that is after I took 2 years off and really took the time to get a publication, present at conferences, kind of network a bit. A lot of it is also just like kind of who your advisor knows, because it is very advisor dependent, or like I said, you apply to an advisor, not like a school in the same sense. And so, taking that time off is really important to make connections, get the research experience, build skills, get publications, but also just to figure out what you want to do. And so that's kind of, I think that part will kind of address more of the question. So like when I was in undergrad, I was in a personality psych lab, studying personality pathology, personality disorders. And then I got a job in a lab that studied psychosis. So, it wasn't really related. But like I said, it was something that they both studied risk, and that was like the core of what I was really interested in, was like risk for psychopathology. And so you're able to like kind of bridge that gap. And when it comes to clinical psych, like it's really important to develop your research interests, because it is very kind of niche, like wherever you go and whoever you're working with. And so something that I really recommend, like I said, the gap year is kind of the expectation, but it's really also critical just to really learn, make sure what you want to do, where you want to specialize. And yeah, so for me, like I said, you get undergrad degree, you take time off in the gap years, get that experience. And I think that for clinical psych, it's like striking a balance of, you want to find something that you want to do, but you still want to have flexibility in that area. So that's really important, like when you're applying and considering programs, like different advisors will do different things, right? Like some people might say depression or bipolar disorder, trauma in early life, like a different kind of range of things. And it's really important to like develop interests that can contribute something novel to like the field, right? So like new ideas, kind of new direction, but that can still fit into someone's existing like lab or framework, right? So like, and for example, like I studied psychosis in my old lab. They did something fully different psychosis. They studied like motor deficits and neuromotor abnormalities in psychosis. And then I came to this lab to study, I study like stigma and social stressors and how that contributes to psychosis. So, my thing was like, your lab studies psychosis, that's my interest, but I want to, I have this other additional, like, more specific interest, right, in this domain of sexual and gender minority stress, stigma, these things. And so it's about like finding the area you want to be in, and then also developing your specific niche that you think contributes something new. And it's also important to understand that clinical programs vary in how much it's like research versus practice. But in general, clinical psych programs are more research oriented, and then you do clinical work on top of it. So it looks like it's mostly like this is like a clinical science model here at UCI, which is what the more research heavy models are called. Some schools do more of like the clinical work, they prioritize that more, and that's something that you should look into when you're applying to places and seeing what you want to do. But the way that clinical psych program is structured are 6 years. So the first 5 years is coursework, clinical practicum, doing therapy, your thesis, and then your 6th year is a full-time clinical internship. So that's like the general structure. And so, like I said, like research is kind of the core part of it. So my biggest piece of advice, I think, is like, if you do clinical psych, you really have to enjoy and want to do research. Like if you want to just practice, it's probably not the best route for you. Like something like a social work degree, like licensed social worker or a PsyD or a counseling degree would be a better fit if you just really want to practice. But like clinical psych really is a lot about research and kind of intertwining those. And then in terms of job opportunities, there's because you do so much, because you do research practice, and we also do teaching, TAing, all those kinds of things. There's lots of different things you can do. So some people do the academic track where they become professors, right? And they teach and do research. Some people do still go into private practice, right? And they do just, they actually see clients, right? They have their practice, they act as therapists. Some people also, though, it's not uncommon now to work in any kind of research setting. So some people work for like Google, or like someone I know went to like work for like Bumble, or like anyone that does research anywhere, right? Like you essentially develop skills to be a research scientist. And so you can also go into industry if you like want. Most people do kind of go into academia or practice, but you really have like a pretty wide breadth of things you can do after, which is one of the appealing things about the PhD. It is a lot to juggle when you're in it. But afterwards, you can do academia, you can do practice, you can do research anywhere. You can kind of do a mix. You can like work in hospital settings, work in clinics, work at universities, So hopefully that kind of gives a good overview of clinical psych. I know that's something that I regret the most is when I was an undergrad, no one really told me what it meant to get a clinical psych PhD. They were just kind of like, this is interesting, like you study psychopathology. But it's a lot of research experience. You really, kind of get publications, presentations, and really just kind of get into it. So.
And then did you tell us what your goals are? Have you decided exactly what direction you want to go yet?
A great question. So my initial goal, it was to go into the academic route and become a professor and like teach and do research. I haven't, quite settled on that. I do enjoy, like, I'm actually just starting practicum in a month, so I haven't started being a therapist myself yet. You start that your second year also, so you start pretty quick, first year's classes, then you become a therapist pretty soon. But yeah, I would like to kind of do research and teaching, which is nice because, like I said, in the program, you get to TA and you do lots of research and you do a lot of clinical work. It's about like 20 hours a week of clinical work, and then research and TAing classwork is kind of the rest of it. So you get a nice balance. But right now I'm kind of on the academic track, but we'll see.
Excellent. Thank you so much for sharing. Do we have any questions come through, Anonymous? Okay, so we do want to be respectful of each of your time. Thank you so much for coming to share your experience with us. We have a couple minutes left, so I want to give each of you about a minute or so to kind of give your parting words or words of advice to our UC3P scholars as they are finishing up their last few years at UCI and preparing to go on to graduate programs. Any last minute advice?
Yeah, I just want to say to take initiative and take advantage of the resources UCI specifically has. Like for my experience in optometry, there's literally a Gavin Herbert Eye Institute on campus. So it's super easy to go in and shadow and like find opportunities through there. And at UTC, which is literally across the street from campus, there's a literal optometry office right there. And the doctors were part of the UCI's pre-optometry club. So they're really open and receptive to students coming. So if you want to like explore these fields, you have to like take initiative and take advantage of the opportunities, especially going to a school like UCI.
Excellent. Thank you so much.
Enjoy the time you have left. Cherish it with everything you have. I know that's not what you want to hear because right now you probably have a slew of thoughts and emotions with where you're currently at, but you truly, I think one of the best things is learning how to enjoy the moment and enjoy the journey. it's really easy to get caught up in the destination and like, you know, I'm just gonna get this white coat, or I'm gonna get this, I'm gonna get that. And when I get there, it's gonna be great. I'm done. But it's like you are disregarding every single day that you woke up and made an active decision to continue chasing your dream, to continue chasing your goals, to continue trying to improve, you know, inch by inch. And that's beautiful in and of itself. So enjoy the journey, enjoy each day waking up in your dorms, wherever you're at, your apartment, and take pride in the fact of how far you've come and enjoy where you're going.
Hooray, you stole mine, by the way. That was exactly what I wanted to say. And I mean, that one office quote where it's like, Andy's like, I wonder when people can tell me when the good old days are. Because once you know, yeah, because right now it feels like you're stressed. You don't know what's gonna happen, but trust me, like everything works out. Even right now, like a lot of my like peers are like, I'm so stressed, like rotations are happening. And I'm like, every day, just take it one day at a time. That's the grad school motto. One day at a time, we'll somehow, some way, we're gonna make it. Just enjoy the time, even though it's hard to enjoy things, but because you're never gonna get this time back. Everyone gets the same amount of time in life. It's about how you enjoy it, how you appreciate it, and from then on, just think how life takes you. So please enjoy your time.
Carlos or Nagreen, do you want to go next?
Yeah, so I basically kind of was thinking the same thing, you know, just try to grow yourself a little bit every day. You know, keep your goal in mind, try to move forward with that every day. But with that being said, you know, you got to enjoy yourself every now and then. Don't be scared of grad school, you know. I'm gonna I'm gonna buy myself another Disney pass, and I'm gonna be going to Disney every week despite, you know, like working, lab, all the things that I do apart from pharmacy school. So, you know, just enjoy the journey the best you can.
Yeah, and I agree with what all my peers said. And I just remember like being in the time of like unknown and like applying and figuring this out is just like such a scary feeling. But like, no, you worked hard. You are in UCI, like you are in this Zoom meeting right now, like you're being proactive for what you want to do. So yeah, as they said, like it's gonna work out, and make sure you really enjoy it day by day. Yeah.
Any parting words, Maxim?
Yeah, I feel like everyone really, you know, kind of covered a lot, but I think just like be kind to yourself. It's really hard and it's gonna be hard for a while. Um, I think, yeah, honestly, like at the end of the day, sometimes like you won't always do something right. You can't always give 100% of your energy to everything, right? Something is going to have to get less of it, and that's totally fine. And so just kind of learning to be kind to yourself and understanding you're human, and it's okay to not always be working, to not always feel productive, like that's normal. So yeah, just take it easy on yourself.
Excellent. Well, thank you all so much for coming. Let's give them a round of applause. We definitely enjoyed hearing all of your experiences. And thank you also for sharing your LinkedIn information. We are all very aware of how important social capital is in our development and our success. So we'll be encouraging everyone to connect with you all via LinkedIn, so that if you guys want to continue conversations, they are open to receiving your invites and continue conversation. So again, thank you to each of you for joining us today. Thank you so much, and we appreciate your time. We know you're very busy, so thank you. Say that again?
The clapping one.
It's gone. It's gone.
Because it's a PDF, I don't think we have access to the LinkedIn links. Oh, I see.
So we'll, yeah.
I could send, I could resend it as a, maybe like a
It's cheap.
Word document. I tried.
Yeah, and then PA.
Have we tried reaching out to folks on LinkedIn before?
A great question. How many of you guys have a LinkedIn? Raise your hand if you have one.
How many of you all are active on it? How many of you have updated your LinkedIn within the past few months?
Post like those paragraph
Yeah.
updates. I
Yes.
find them odd. I don't know. I feel the same way.
Yeah. So just some advice, when you're reaching out to folks, mention who you are, right? Where you came across them, how you met them. Say, hey, I really appreciated that you shared this about your experience. I would love to connect about this further, right? And for the most part, if folks are willing to share their LinkedIn with you, it means they're open to connect. So take advantage of it. Like seriously, do take advantage of it. That's how you grow your networks, how you hear about opportunities that you may not have heard about otherwise, right? So you want to make sure that what the program is offering, that what UC3P is offering, is something that you're adding to your arsenal, right? That these connections are people that you will be able to tap into in the future. And something that may help you later when you're applying to graduate programs, right? Suppose you apply to Western University, right, for one of their programs, that when you're being interviewed by somebody representing the university, you're able to say, hey, I actually spoke to this student in this program. Because that'll be able to demonstrate that A, you're somebody who has initiative, right? You're somebody who's willing to get into contact with other professionals. And it shows that you're somebody who visualizes yourself in that institution and somebody that wants to understand what that experience may look like for you, right? So take these interactions from that perspective as well. Don't be intimidated. And it also helps, I think, that we had some anteaters who were panelists, right?
Yes, absolutely.
Just personally speaking, when I've reached out to folks on LinkedIn, right, I'll go into UCLA School of Medicine, for example, right? And if I see that there's an anteater, right, an alum who is in that school, I'll be able to say, hey, I'm currently a UCI student. This is one of my objectives. I would love to connect to talk about how I can get to where you are, right? So yeah, take advantage.
I think that was all very great. And I think those of you who do not have a LinkedIn, it'd be really good, even if you don't feel like you know what to put on there now, you should start. Just start it because you guys are all in research labs. You guys are all doing things in clubs and organizations. And someone mentioned it's just like social media for career. That's exactly what it is. And this is a professional space for you to show off what you're doing. So just like Instagram or Facebook is to show off your regular life and what you're doing, LinkedIn is a space for you to show off your professional accomplishments. And so that when, you connect with that person or that individual that you met in passing, they'll go to your LinkedIn and say, oh, she has experience or he has experience in X, Y, and Z. I know, something that we can connect on with. So I think it's very important, even if you don't feel like, I haven't had X, Y, and Z, if you really think about your resume, you have a lot to put on your LinkedIn. And I would encourage you to utilize it like you use your social media. So when you do have like presentations like this, if we took a picture, you post on your LinkedIn, oh, UC3P Scholar event that was really great and you've attended it. And then you can maybe tag one of the panelists and say it was really great to hear from you from this panel. And just those like connections and interactions, those are all kind of little things that can contribute. You never know what opportunity they might contribute from a conversation that is had. So don't minimize what you're doing to the point where you're like, oh, I don't want to put that online. Well, if you put it online, it might be exposing you to an opportunity. It might be opening a door that you don't even know someone is looking for you. So you're make yourself available for someone who is looking for someone like you with your skills, to find you. And that's what LinkedIn is about. It's really about that establishing yourself and putting yourself out there in a social way so that people can find you. So I hope you guys can kind of switch your mind frame on what LinkedIn is, and it really is for your benefit, and come with that mind frame of let me post or let me display what I have accomplished, so that when I do go and request those people, they can kind of see an outline of who I am and what I'm about and what I'm looking for, so that they can get right away kind of how they can help you. And vice versa, when you guys get to the point where maybe mentees are requesting you, then you'll see, oh, you've done this. I have someone else that you might connect with to give you opportunities. So definitely, if you do not have a LinkedIn, this is the perfect time. Open it up, start it, get your picture up. You're at UC Irvine, you're in a lab, that's something to add as your activities. What jobs do you have? All of those things, okay? Do you guys, oh yeah, go ahead.
Just wanted to add very quickly, if you have any kind of like hesitation about what you should be adding to your LinkedIn, you can also go to the Division of Career Pathways. I know that they will also be able to help you with that and be willing to review your LinkedIn for you. So use the resources on campus.
Absolutely, use your resources. So yeah, I encourage you to go ahead and start one, open one up if you don't. And then something that I know I've seen at other institutions is they do have LinkedIn groups. And so with those groups, like if we were to decide to start a LinkedIn group, we can pull in UCI alumni to that group that are in the health professions already that you guys are interested in. So we can literally kind of develop our own little network of alumni and people you guys can kind of reach out to immediately. So that's something that can definitely get on our list of things to do too. Excellent. Do you guys want to start the debrief? We have about 20 minutes, so we'll probably take about 10 minutes to do that, and then you can go into the assignment overview.
Yeah, okay. I think we could just do a group discussion for the sake of time. Yeah. Okay then, so we're gonna kind of do what we did in the beginning of the session, so get in pairs or groups of 3, depending on who you're sitting with. And we're just gonna ask you a few questions about the panel. So the first one is, did you learn anything today that you didn't already know? What are some key takeaways from today's conversation? And is there anything you'd like to hear more about? So I could write them on the whiteboard too. So again, did you learn something new? Key takeaways, and what would you like to learn more about? Yeah, so feel free, like 5 minutes to talk to your neighbor, and then we'll share.
Are actually more normalized.
Real.
We ever read inspectors?
Yeah.
Oh
yeah, thank you.
Navigated the university well. Because, you know, I appreciate the point of like someday this fall into my face, not like intention. Then like trace that, like, and I think that's an important thing to respect. His I would say I'm doing like I would never. It was good. I mean, but I think it was good that at least that he reflected authentic experience that he had and he's observed, and then but still there was.
And then I highlighted
Yeah, and I think the other speakers gave very powerful reasons to consider. Anyways, I think it was great.
You were in as far as piece of you.
It was great.
Okay.
Yeah, really good.
Okay. I think now it feels
I wonder if there's
that you value mentorship and to be given opportunities so that you don't feel stagnant. I feel like I don't really do that. I feel like it could be really valuable. Because like it worked out for him. Like his mentor was really helpful.
Yeah.
Like they helped him with LinkedIn and they gave him a whole bunch of opportunities. And just when we think about this one time where I kind of applied that, like this summer, I had a boss from another job here on campus, and I only mentioned like that I wanted like opportunities to grow, and she was super helpful, and she gave me a whole bunch of like new tasks to do to grow and learn, and because of that, she's willing to write me like a really strong letter of recommendation. So I feel like that advice was really, really helpful.
Yeah, I think he said closed mouths don't get fed, something like that, which I hadn't heard before, but it's really good advice because you don't even have to ask someone for something in particular, just you saying like, yeah, I think, it'd be great to do more research. And, maybe if they hear about an opportunity, your name will come up.
Just expressing what you're desire.
Yeah, just them hearing.
Not asking, but just expressing. Yeah, that's excellent.
That's 100% what happens with me. Like just when people just mention in my lab, they're like, oh yeah, I'm looking to do something. And then when I hear that something, I'm like, oh yeah, like William mentioned that. Like, and then I know to tell William, yeah. So yeah, I think that's really, on the other side, I see that too.
Any others for any of the questions?
I can kind of going off of what we said, but I think the one thing that kind of stood out was like taking any opportunity and like trying to find opportunities. I feel like sometimes like I'm kind of shy. Like I thought like LinkedIn was only for like business people, but now I kind of realized like, oh no, like you can utilize that to your advantage and like reaching out to people and trying to put yourself out there. So I think that's something like a key takeaway that I'll try and like learn and grow on.
Yeah.
Yeah, honestly, I've known Trey since I was the first year, so I saw him go through like all that pre-med stuff, and knowing that now he's like into nursing, I was like, what, like for real? But I literally quoted him on some things and highlighted it in my notes because like it really stuck. So when he said, pressure makes diamonds, grad programs want you to shine, so they will apply that pressure. That stuck with me because I'm already stressed, and sometimes I don't take care of myself the way I should. But then when he also followed that up with you're a person first and a student second, don't forget who you are and what makes you happy. It made me like realize like, whoa, at the end of the day, I'm only 21. Like I'm not even 30 yet. Like I'm still young. I still have my whole life. Like I want to experience things. So yeah, and then I also quoted the closed mouths don't get fed because that's true, and that's just something that I've kind of always known. Like since my first year, I just like to talk a lot, and it honestly has gotten me to places. Like I was also part of the campus rep program that Trey was in. I was part of that for 3 years. And honestly, that took me a long way. Like that's how I got into my first research lab. Through that research lab, I got into a medical lab. Through that medical lab, I'm getting clinical opportunities, and I got into this program. So it just kind of like, snowball effect. So yeah, I just quoted him on a lot of things.
I think a key takeaway I had is that if I were to take a gap year, that to make sure I have a plan, because he felt that when he said like, oh, if you don't have a plan, you're gonna get lazy, and I felt like he said that to me. Then I'm just like, oh yeah. So if I were to take a gap year, I'd try to make a plan on like what I should do.
Did anyone wish that they heard about something else that no one talked about, or do you think everything was covered?
I know some of them got masters, so I would have been interested in hearing about that because I feel like a PhD and then going into like med school or pharmacy school is a really long commitment, but masters is kind of like a middle. So whether or not it's advisable to take a gap year before that or like just go straight into it would have been something nice to hear.
Thank you. I'll keep that in mind. You're gonna say something too?
Yeah, I think I probably would have wanted to hear a little bit more about like their grades. Because like I know that I still have time and there's a lot of steps I can take, but maybe hearing specific steps and experiences from these students would be helpful because like my GPA scares me. And yeah.
And things like that, we hope to continue to work with you with to make that plan. So typically, if you're unsure about something, sitting down and looking at your GPA and making a plan going forward will kind of soothe that kind of anxiety about where you're at. So like if you have a plan laid out with this is where your GPA is now, this is the rest of your quarters you have. What is your plan to make sure that you're continually move forward and having that academic maturity, and in the midst day to day going to tutoring and doing all of those things and the time management and also taking care of yourself. That's going to be very important in kind of organizing yourself so that you meet your goals academically and personally and professionally.
Perfect, thank you. And then before we started the workshop, Josue emailed you all a link to a Google form. So can you pull that up, please? And for the next maybe like 5 minutes, we have 2 solo reflection questions that we all want you to kind of think about. Yeah, so let me know when you get there. We wanted to give you some time to do it now so you don't have to worry about it over the weekend. So if you can answer those now, go for it. If not, if you want to kind of sit down and give more time to this later on, that's okay too. But
maybe if they want to just go ahead and pull it up and have it ready.
Yeah.
And then we'll talk about the assignment. And then if you guys want to finish it here, you can. Otherwise, just try and get it done. I think we have it by next Wednesday.
Yeah.
Is the deadline. So if you guys have it up, that's fine. If you guys want to go ahead and discuss the assignment for next week, we can start that.
okay, yeah. Let's see. Do you want to talk about that, or would you either or?
Yeah, well, why don't y'all introduce it as you see it, and then if there's any thoughts I have, I can.
Okay, perfect.
Yeah.
So as you all have known for a couple weeks now, the concluding assignment for our summer meetings will be a 3-minute elevator pitch discussing your research. We've gone ahead and prepared some guidelines for you all that we will be sharing with you later today, so you can review, right? But essentially, we want you to create a 3-minute elevator pitch that you might be sharing with somebody on the funding board, with a faculty member, right? With one of your peers, in which you are discussing the importance of your research, right? What your research is and why you're focusing on that research, right? So you might want to perhaps start with a story, right? When I was younger, I had this experience, I noticed this issue. So I decided to focus my research on this in order to have this impact, right? We've also included a breakdown of the POIC principles that Professor Bilomek outlined for us earlier in the summer, about 2 sessions ago, 2 meetings ago.
I have it up. I pulled up the assignment guidelines.
So you can feel free to take into consideration those aspects, right, when you're formulating your final research question as well. I've also included some questions for you all to consider, just to make sure that you're hitting all the basic points during your presentation, right, and when you're creating this elevator pitch. I would encourage you all to consider your audience, right? Who is it that you're speaking to? Because your elevator pitch is meant to be dynamic, right? It's something that you're supposed to be able to change from person to person based on who you're speaking with. The way that you present your elevator pitch to me might be different to the way that you present it to Professor Bilomek, right? So do keep that in mind. Professor Bilomek, I don't know if you wanted to add anything.
Yeah, I think that's really great, and I think we've added, so in addition to kind of the guidelines of what the 3-minute presentation should look like, we shared some resources that came from the Europe office. So the Europe office provided 6-hour-long video about how to make an elevator pitch, so that was too much. So I just kind of cut out like 2 important clips that I thought were really valuable. There is a lot of good stuff throughout the whole video. It might be like an hour, I'm serious. So, I just carved out a few sections that are really important about like the components of a good elevator pitch, the reason about it, and this notion of story, like Josue mentioned, is like one of the most important parts of an elevator pitch. And sometimes it's a story from your own personal experience. It could be, I was bit by a radioactive spider, or it could be, but it could be how I found my way into a lab, how I got interested in a topic. Sometimes if you're doing a topic that doesn't directly personally affect you, you don't need to make up some story. It's like, yeah, one time I was an antibiotic resistant, bug. Like that doesn't have to be the case. You can just give a kind of a hypothetical example. Like imagine you're a patient at the hospital and you have, there's an infection or something you saw in the news. So just something that kind of gives some grounding to why what you're studying is important to you, and then how your efforts kind of are contributing to addressing that problem that your story illuminates. So I think that, so there's 2 kind of short video clips. What we're asking you to do is to watch the first video clip, just write a couple of quick reflections on how you might apply some of those techniques in your paper. There's just some discussion questions there. There's a second video clip, again, with a couple of written prompts. And then the third part of it is I want you to pair up with 1 or 2 other people in this group to practice your elevator pitch once before you bring it here and give each other a little bit of feedback. And so on the written assignment that you submit, you're going to include your research question. That's one of the things. You're going to include some of your reflections on how did you come about shaping your elevator pitch. And then you'll also reflect on a little bit like, hey, when we shared this with our group, these are the people that were in my group. Actually, I want a selfie of y'all in the group because we need good Instagram content. And so, but also, this was something I took from that experience, and and then you'll actually give your presentation next week. So you'll be submitting kind of the written assignment by next Friday morning, and you'll be giving your 3-minute elevator pitch in the meeting next Friday at noon. So any questions? And as you're looking at that, yeah, go ahead.
So it's next Friday we're presenting. I'm gonna be out of state, so I won't be able to make it in person. So should we like submit a video or like just the written?
Yeah, so
Which state?
I'm going to Maryland.
Because we could move the meeting to Maryland. Does everyone want to go to Maryland? Okay. Yeah. Okay, yeah. That's exciting. Okay, go ahead.
Yeah, so what we'll do with that is, what I would like to do is have you still present. So next week, everyone's presenting in front of everyone. What I would like to do is with us, probably with the UC3P team, we'll just have a Zoom. So probably sometime next week, why don't you email Josue and let him know a time next week that you're available, and we can just take 30 minutes, 30-minute slot, but it's only a 3-minute presentation for you to do it there, and then we'll just record you on Zoom there.
Okay, sounds good.
And same for anybody who has already has let us know that if they are not going to be here next week, we'll do the same thing for each student that will not be here to do.
Sorry.
Go
No, I was just gonna say, hopefully this isn't something that's stressful. Just think of it as a chance for you to practice and get feedback from us.
Yeah, one thing I wanted to say about the LinkedIn is that like it's such an important thing because it kind of forces you to sort of put down somewhere like, how do I see myself? Like, what am I doing or what am I about? So it feels kind of stressful to almost figure out like what activities. And Lena kind of called out like, y'all are doing a bunch of stuff that you can list there, but it's not just listing what you've done. It's sort of like choosing the things that I've done that represent kind of what are my skills. And so this is
curating your space.
Curating your space, yeah. Elevator pitch is kind of like that too. It's sort of like you kind of know what you're doing. And then I think the biggest thing that makes us feel inauthentic is when we don't have we can't put into words why we're doing it or like what's going to come of this. And this is an opportunity to do that. And I think you're all going to do great, and it's also going to be fine if any of us stumble or this is going to be like totally safe. Like this is just going to be our next attempt at trying to articulate what we're doing.
And once you've gone ahead and met with your group, you've completed all the portions of the assignment, send them over to me. You can go ahead and CC Veronica just to make sure that we both receive it, right? In case one of us misses it. But that way we can make sure, that you guys are meeting, and we'll be able to refer to that later on in the academic year if need be, when we're preparing for your op.
And then has this already been sent to them yet?
No, it has not.
Okay, so today you guys will get the whole outline, so you know exactly what to do and when the deadlines are and things like that.
Are there any questions?
I hope today was fruitful and meaningful.
That was one of the best panels like that I've ever gotten to. I was just listening in on it and I just thought, man, that was a solid group. So round of applause to the organizers and to the panelists, that was outstanding. And thanks for y'all's wonderful questions and then your reflections afterwards. I could tell y'all really took stuff from it. So so good. Yeah.
Thank you all. And then definitely take some more food. If you have anyone else who was, feel free to pack up a little pack and take it. There's no judgment at all, so take the food. Okay.
3 hours for